Hey everyone, I am going to do the Sbar on our assignment of Susan Clark. Susan Clark presents herself today as a 55-year-old female who underwent a colon resection resulting in a colostomy, who comes to us experiencing mild abdominal discomfort, but there are no signs of showing any infection at the surgical site. She has no history of skin issues around the stoma and verbalizes understanding the basics of ostomy care, but is nervous about changing her ostomy bag, which is totally understandable. For me, the background is history of colorectal cancer, postoperative colon resection, which resulted in a colostomy bag. She was in for a transverse colostomy around 2 days ago. Upon assessment, my first interaction with the patient, I would ask her if she has any pain around the surgical site. Empathize with her on how she's feeling really nervous about how to care for her colostomy bag and how it will change her lifestyle. Find out education that she's already been given regarding the care needed for changing and cleaning out her colostomy bag, because they have to do that before she gets discharged, just so that they know that she understands on how to do it herself. Give suggestions regarding making it easier for this process. I would check the area around the stoma for any breakdown, redness, or swelling. Make sure she has the correct cutout around the stoma that is not too small, and that the bag has been put on correctly and fastened down. I would educate her more for a well-balanced diet that includes starchy and protein foods, to avoid any high sugar or greasy foods, because if that were to happen, she would have a lot of leaky stools. That could also result, as for her possibly forgetting to clean around her stoma, that can possibly result in infection, which would obviously not be good, especially with fecal matter. To go on walks and not to be strenuous when bending over and such, because then she will make her stoma pop out even more and can cause a lot more inflammation. To wait at least a few days to a week to exercise, to change the colostomy bag, to make sure you have the correct size of skin barrier sizing the ring around the stoma, to always have soap and water to clean around the stoma with the washcloth. Make sure no fecal matter is anywhere to be seen because of infection occurring. Once you have the skin barrier intact, place a new bag over the skin barrier and clasp the circle around all the way around. Because if that is not clasped or fastened down, then there can be a lot of leakage coming around the stoma area and cause a lot of infection. And if emptying the bag, just make sure you have a bedpan to dispose of the fecal matter into, and empty in a commode, and make sure that the bedpan is of course cleaned out. The potential complications with a colostomy bag can be infection around the stoma opening, which can cause the stoma to bleed and cause more redness. Make sure to clean stoma after every bath, as in bed bath if they prefer a bed bath, and when you empty the bag. Only use soap and water. Can also use unscented wipes that you obviously do not dispose of in the toilet, but in the trash can. And what I would say to her is, I honestly could not imagine what you're about to experience, because having a colostomy bag, I'm sure, is a huge lifestyle change. But you can also go to support groups and such, just to help you out mentally and physically. You have to be careful, once again, about excessive bending over or doing anything strenuous or anything that could stress around your stoma area, around your abdominal area. And to eat well-balanced foods, and to drink lots of water. Drink lots of good fluids for you, especially electrolytes like Gatorade and such like that, but zero sugar, no high sugar. Recommendation: I would recommend support groups with people who have had a huge change of lifestyle with their GI, their gastrointestinal, and self-image. So meaning if need be, she can go to a therapist or contact a therapist regarding self-image and her confidence, because colostomy bags, unfortunately, cannot be a confidence booster. It would make you feel like you never want to go out to see the day of light again. To go on walks and watch eating unhealthy foods at least few days to a week after your procedure, as in not doing anything extraneous until at least a few days or a week after your procedure. To, of course, make sure you keep the surgical site clean and dry, as well as keeping your colostomy bag clean, and change it 1 to 3 times a day to prevent infection and further complications. Okay. Now, I would also ask her if she had any questions regarding her actual colostomy bag and give her extra supplies for the bags, and to make sure that she has access to extra supplies, bags, possibly scented wipes, good unscented soaps that she is not allergic to, or any of her allergies for that specific reason, and to also go over possibly a eating plan of what she can or cannot eat to educate her more on that as well. Okay.